Hi, this is Dr. Deepak Kumar from Capri Institute of Manual Therapy, India. Today, in this video, we will discuss what care you shall take while doing physiotherapy, therapeutic exercises, or manual therapy by yourself in the comfort of your own home and still get professional and magical results. Yes, professionals and magical results. This educational video is just to help the people in present tough time everyone is going through during this coronavirus lockdown situation, or because individuals are not able to visit physiotherapists or doctors because of any XYZ reason. In case the problem is not getting solved by these self-exercise videos, either one shall consult a qualified physiotherapist or doctors, or individual may fill our online form at our website caprispine.com. And this link is also mentioned in the description of this video given below. And after we go through those details, and in case it comes under our specialty, we will guide the individual by sending specific video clips demonstrating exercises and techniques in great details. So one can do physiotherapy or exercise therapy or manual therapy at home by himself or herself for the problem they are having. Now, what are the instructions to do these exercises? How do you do those exercises? What should you keep in your mind while performing these exercises to get optimal, or I should say again, magical results? While performing these exercises, make sure it has to be done in a pain-free way. No pain during and after shall be felt. Remember, pain is your friend, not your enemy. It tells you there is something wrong with the body. It must not be ignored. Rather, you shall find the cause behind it and do something about it. I have already explained various causes of mechanical pain in my other videos already released. No pain, no gain theory does not work here. It all must be pain-free or pain relieving. However, slight discomfort like stretching, stresses are okay. And that should also disappear after some time by itself. So, I advise individual to do these exercises just twice a day with a repetition of 10 times only. Don't overdo it. So I repeat, while performing these exercises, make sure it has to be done in pain-free way. No pain during and after shall be felt. Do it gently and slowly. So what are those indications? I would say any neuro-musculo-skeletal pain. Make sure it is not the visceral pain. I am not talking about visceral pain at all. It is only and only for neuro-musculo-skeletal pain, that too mechanical in nature, not pathological. Mechanical in nature, not pathological. These exercises are not for active pathological pain. So, indications are any neuromusculoskeletal pain. If not contraindicated, it is indicated. Give it a try. Majority of time, these self-exercises works magically. I again repeat, magically. Now, question is, how does one know whether it is a musculoskeletal pain or not? Well, I would like to tell some examples of indications for the purpose of understanding which are those neuromusculoskeletal pain. So, neuromusculoskeletal pains are, though not limited to, so neuromusculoskeletal pains are joint pain. Any joint pain, muscle pain, tendon, ligament, or pain coming from fascia or joint capsule, not the pain coming from the bone. Any joint stiffness or weakness, any ligament sprain or strain, muscle strain. Make sure it's not a tear I am talking about. I am talking about a sprain or a strain. If there is a tear, make sure you consult the physiotherapist or the doctor before doing those exercises. Probably you need rest, good amount of rest before starting those exercises, or if it is a complete tear, probably you need to go for the surgery for the same. Next one is osteoarthritis, frozen shoulder, tennis elbow, sacroiliitis, cervical or lumbar spondylitis, disc prolapse, or one call it a slip disc, sciatica, radiating pain or radicular pain, post-traumatic pain, stiffness or weakness, post-operative pain, weakness or stiffness, post-immobilization pain, weakness or stiffness. Like after the trauma, sometime you go for surgery or you go for immobilization for some time. So after trauma or immobilization or after surgery, you still have joint pain or the stiffness or the weakness around the joint. It is a clear indication for those exercises. But make sure in last three cases like post-traumatic stiffness, post-operative stiffness or post-immobilization stiffness. In these three cases, please do these exercises only in case your treating doctor has already referred the individual for physiotherapy. Now question comes, what precautions one must take while performing these exercises? Can these exercises be harmful than doing good? Yes, sometime it may do. But only if someone does it wrongly. I repeat, only if someone does it wrongly or excessively. Or if done on a person having any of the following yellow or red flags. Or one may call it precautions or contraindications. Remember I said earlier, if it is not contraindicated, it is indicated, give it a try. So one shall also be aware of yellow or red flags in which the individual shall either be doing exercises under supervision or one shall not be doing these exercises at all in case of red flags. So please do these exercises only under supervision of a qualified physiotherapist in case the individual has any of the following yellow flags. Otherwise, it is absolutely safe to do these exercises. So the precautions, or one may call it yellow flags, are if someone has inability to understand these instructions or exercise as explained, joint hypermobility or instability, in case of disturbed sleep since long, mild osteoporosis. Please note, I am saying mild osteoporosis, not moderate or severe osteoporosis, which is a red flag. So mild osteoporosis, it is okay to do these exercises under mild osteoporosis. Gastrointestinal or genitourinary pain, sometimes back pain are also due to kidney stone or ureter infection or because of abdominal cramps. Obviously, these exercises will not help you because the cause of the pain is somewhere else. It's not a mechanical pain. It's a visceral pain. It's a systemic pain. Another yellow flags are in case someone is having high or low blood pressure, similarly high or low glucose level, hemophilia, if the person is on anticoagulant therapy, any bleeding disorder, and if the individual is pregnant, then one shall consult with the doctor before doing these exercises. Or in case there is any emotional disturbance, please do these exercises only under supervision of a physiotherapist. So if the individual has any of these yellow flags, please do these exercises only under supervision of a qualified physiotherapist. Otherwise, it is absolutely safe to do these exercises. Now the question is when not to do these exercises. So please don't do these exercises in case individual has any of the following red flags. So the contraindication or the red flags are moderate to severe osteoporosis. Now, earlier I said mild osteoporosis under yellow flags where you can do these exercises, but now I'm saying moderate to severe osteoporosis where you should not be doing these exercises or should be extremely careful or talk to your doctor or the physiotherapist before doing these exercises. If the individual has constant or severe pain which is neither increasing or decreasing with movement of the affected joint, means if it is not a mechanical pain. If there is any increase in pain, swelling, weakness, stiffness, or any other symptoms get increased. Unexplained pain or unusual sign and symptom or pain, don't do these exercises. If someone having neurological deficit, cervical myelopathy, people are also not advised to do these exercises if there is recent history of trauma, injury, open or infected wound, fracture, muscle or ligament tear or any other soft tissue injury. Take appropriate rest as advised earlier also. Take appropriate rest as advised by the treating doctor or the physiotherapist. In case someone has loss of sensation or altered sensation in the affected area, reduced or loss of blood circulation in the affected area, or any discoloration of skin, burn, open wound, skin rashes in affected area, please don't do these exercises, or do these exercises only after consulting your qualified physiotherapist or the doctor. If there is any loose metal implant in affected area, in case of fever, in case of infection or any acute inflammation of the affected area, tumor, cancer, tuberculosis, metabolic bone disease, aortic aneurysm or any severe cardiovascular problem, please do these exercises only after consulting your physiotherapist or doctor, or don't do these exercises. These are the red flags. Now question comes, how do we recognize these red flags? Don't worry, I will also be discussing how to recognize some of these red flags by non-medical person in case someone not able to visit doctors due to this coronavirus lockdown or any XYZ situation. Let's do it in sequence of more common to less common red flags. Following could be the sign and symptoms of a broken bone. Recent history of fall, blow or other traumatic event, swelling or bruising over the bone, deformed affected area, pain in the injured area get worse when the area is moved or pressure is applied, any inability to bear weight on affected leg or unable to lift something or put weight in case of upper limb, loss of function in the injured area, in open fracture, bone protruding from skin. These could be the possible sign and symptoms of loose metal implant. Pain ranging from mild to severe, popping or crackling sound coming from the implant side, unreasonable swelling or heat coming from the operated area, excessive fluid around the joint, inflammation of affected tissue. This is where joint area becomes swollen, warm, red and often painful as a reaction to implant failure and or as a result of infection. In case the implant is infected, subject may also complain of fever, chill, muscle ache, etc. Problem with mobility or joint instability might also be there. Thickened joint tissue might be seen. Bone destruction might be seen on X-ray. Uncertainty might be felt by the subject. In this, the joint feel insecure, as if the person's leg may give out while walking or standing. Or in some cases, the joint feel as if it is getting locked, unable to bear weight in case of lower limb or unable to lift something or put weight in case of upper limb. This could be the possible sign and symptoms of neurological deficit. Partial or complete paralysis might be seen. Sudden muscle weakness could be there, which could also be progressive in nature. Uncoordinated movement might be seen. Disturbed gait could be there. Partial or complete loss of sensation might be seen. Frequent or severe headache with no history of injury could be felt. Problem with swallowing or change in speech or vision or hearing, problem with the balance, coordination or falling might be seen. There could be difficulty in reading and writing. Poor cognitive abilities like ability to understand and perceive might be seen. There could be unexplained pain, decreased alertness might be seen. Now, these could be the possible signs and symptoms of gastrointestinal or genitourinary pain. Frequent or severe abdominal pain, frequent heartburn or indigestion, frequent nausea or vomiting, change in or problem with the bowel and bladder function. Back pain could also be due to urinary tract infection, as I said earlier also. And these exercises won't help individual as the cause of pain is different. It is a visceral pain, not a mechanical pain or musculoskeletal pain. Remember, in female, unusual menstrual irregularities could also be the reason behind back pain. These could be the possible signs and symptoms of cardiovascular problem. Shortness of breath, dizziness, pain or feeling of heaviness in the chest, pulsating pain anywhere in the body, constant and severe pain in the lower leg, especially in the calf area or in arm. Discolored or painful feet, swelling of the feet without any history of trauma or injury. This could be the possible sign and symptoms of active tuberculosis. Coughing that lasts for 3 or more weeks, coughing of blood, chest pain, or pain with breathing or coughing, unintentional weight loss. Please note, I am saying unintentional weight loss. If someone is purposely losing weight, it is absolutely fine. I am talking about unintentional weight loss. Fatigue, fever, night sweat, chill, loss of appetite. These could be the possible sign and symptoms of cancer. In case the individual has persistent pain at night or constant pain in the body, which is not getting increased or decreased by any physical movement. Unexplained weight loss, loss of appetite, unusual swelling or lump or growth, unexplained regular fatigue. So these could be the sign of some serious disease, and one must get examined by a doctor before doing these exercises. Otherwise, it is absolutely safe to do these exercises and you'll get beautiful results by yourself. In case you have any doubt or query, please post it in the comment section below and we will get back to you as soon as possible. Please also forward it to anyone you think is in need of this information. If you like the video, please hit the like button for more educational video. Please subscribe to our YouTube channel Deepak Kumar Capri and hit the bell icon to receive regular updates. Thank you very much for watching this video. Wish you a very happy, healthy and mobile lifestyle. Thank you.